Well, health experts in the UK are issuing some strong warnings about a likely second wave of coronavirus infections. And that comes as Prime Minister Boris Johnson says the country is ready to rise from hibernation. His plan is to reopen pubs and restaurants on July 4th. The UK has one of the world's highest death tolls from COVID-19 per capita. Public health leaders have just published a plea in the British Medical Journal saying urgent action is needed to prevent further loss of life. Dr. Chaand Nagpaul is one of the physicians sounding the alarm about a second spike of COVID-19 cases. He's chair of the Council of the British Medical Association and joins me now. You're sounding the alarm on a second wave, but we're still in the first wave here. Do you think it's a bit too early to open pubs and restaurants and museums and bars?
I think we have to be very cautious because what the government has said is that it will open these facilities with mitigations, but what we haven't understood what those mitigations are. What we need to be aware of is that in the UK we still have significant circulating spread of the infection. An estimated 35,000 people, as we speak, are infected with coronavirus in the UK. The infection, the virus, is just as infectious and contagious as it was when the pandemic started. So if people mix and they're not given the right protections, you will basically spread infections, as simple as that. And we've seen across the globe outbreaks in other countries. Germany, that was doing extremely well in Europe, have now had to lock down 2 areas because of local outbreaks. So none of us can be complacent. And my biggest concern on behalf of the medical profession in the UK, and in fact echoed by leaders of other medical organizations and nursing profession too, is that the government must be extremely cautious about how the lockdown is eased and exactly how we will mitigate against spread if people start being closer to each other and mixing more, between each other.
But you say it yourself, we don't know what these mitigating factors are, and we've all been to pubs and bars and restaurants. You can't wear a face mask. There's no point, really. You're not going to stand 2 meters away from somebody when you're at a bar. Even 1 meter is virtually impossible. So, I guess we're going to have to wait and see. We're going to have to open up and then see in 2-3 weeks down the line after July 4th, was this a good idea?
I don't think that's the right way to go about it, to wait and see. I think the government should put in place the measures it says. It uses the word COVID secure opening of new facilities. So we need to see exactly before the pubs or bars open, how will the government maintain social distancing? Will there be perspex screens? It might not be the same environment of a bar, but it may be something that people will prefer to a bar being closed, but will you be able to have protection that way? Of course, you can't wear face coverings in a bar, but in fact, in the UK at the moment, there is not face covering usage in general in indoor places. There is a requirement now to wear face coverings in public transport, but not in supermarkets and shops and other indoor facilities. We would like at the BMA to see that being the norm, because we know that this virus spreads through droplets. We know that wearing a face covering can reduce that from the wearer, can reduce spread by about 80 to 90%. And we know if 2 people near each other are both wearing face coverings, you reduce that infection risk, that transmission risk, to about 1.5%. So we want the government to make sure that those sorts of mitigations, the physical protection of screens, for example, in public areas, are all in place before the lockdown is eased further.
Right. Do you think it's a good idea to limit or even ban travel from countries that have high infection rates into the UK, like the United States or Brazil or Russia? Do you think that's a good protective measure?
I think we have to follow the right science here. Remember, this has become a global situation after it started in one part of the world and spread. So we know that this is a highly infectious virus that does spread from nation to nation. So each nation needs to have the right measures to prevent further spread. And that, in fact, benefits all of us, because if you get a second wave of a pandemic or an epidemic in one country. That places a risk more, globally. So we do need to make sure there are stringent measures to not spread this infection globally. So I think the other thing to say is that in the UK, at least, we are also concerned around the test and trace system, because you can contain this virus if you do what South Korea did, if you do what New Zealand did, which is to act very promptly in identifying those people who are infected. You identify their contacts, you isolate them, and if you do that, the virus doesn't spread. But to be able to do that, you have to have a really comprehensive testing strategy and a public health contact tracing strategy. And in the UK, we were told by the government that we'd have an app in place a month ago. That has been pushed back now, and we're not sure when we'll get that app. So those are the sorts of issues that every nation needs to grapple with, having a very, very competent and prompt test and trace system.
Yeah, and not all countries have managed to pull that off successfully. You're one of the signatories of the letter asking officials certainly to increase and improve preparedness for a potential second wave. First of all, we talk about a second wave as though it's inevitable. Is it?
No, I wouldn't say that our starting position is that a second wave is inevitable. We need to, make every possible effort and leave no stones unturned to prevent a second wave. That is why we have called for this rapid review, and this rapid review that we've called for alongside other signatories, it goes beyond party politics. It's not a review by the government. It's to bring together the various political parties and have a cross-parliamentary commission, a review within weeks, so that we learn from what has happened in the past and make sure we're therefore better prepared for the future. So we must prevent, as far as we can, a second spike. The second thing to say is that if there is an outbreak in the UK, if you capture the area where you have an outbreak and you act promptly, again, you need a proper agile test and tracing system, you can contain the virus in that local area by having a local lockdown. So our aim would be to prevent.
Sorry to just jump in, because I wanted your opinion about what they're doing in Germany. That's what they were congratulated and presented as a model of how to manage the pandemic in the early days, but then they've had this huge outbreak in a meat processing plant, and what they've done is they've basically fenced off one area rather than implement a nationwide lockdown. Is that what our future is going to look like, do you think, until we get a vaccine, where little spikes in localized areas will be sort of contained locally?
Yeah, so the one thing that they did do well is they identified the 1,500 quickly, and they've now taken an approach to contain the spread of the virus to those areas by a local lockdown. Now, that may well be what we need to do, because that is surely better than having an entire nation have to go into a second severe lockdown. So it makes sense. And that measure has been also employed in some of the other nations in the East, such as South Korea, where you act at the first signs of an outbreak. You don't wait for it to become a national problem. So that is, I believe, the way in which nations need to act promptly to stop the spread across the country.
Yeah, Dr. Chaand Nagpaul, thank you very much, the chair of the British Medical Association Council. Thank you for joining us on CNN.